all, this is Dr. Garima Sachdeva, and today we will be discussing about nerve injuries. So there are three types of nerve injury. The first one is neuropraxia, in which there is only external compression. So this is the mildest form, and the recovery in these cases very fast. It occurs within weeks to months. Most of the injuries which occur are neuropraxia. Exontomis is where there is severe compression resulting in axon damage. However, the outer nerve sheath is intact. So, in this, recovery takes longer, usually several months. Then there is neurontomesis, where there is complete transection of the nerve. It has the poorest prognosis without any restorative surgery. That is, it always requires a surgery for recovery. Then discussing about the lumbosacral plexus injury. So the various nerves which can be injured, the first one is femoral nerve. It comes from the roots L2 to L4. The sensory supply is to the anterior and the medial aspect of the thigh, and it is responsible for flexion of the hip, adduction of the hip, and extension of the knee. The basic complaint that the patient has is difficulty in climbing stairs. And what is the mechanism of femoral nerve injury? It is particularly inappropriate lithotomy position which you give during delivery or any procedure. So basically in this there is hyperflexion at the hip and adduction, hyperflexion, abduction at the hip, and flexion at the knee. So this is how the femoral nerve get compressed around the inguinal ligament. So the other nerves which can be injured is obturator nerve. It originates from the same roots. It supplies the medial aspect of the thigh. It is responsible for adduction of the thigh. So if it is damaged, it results in minor ambulatory problems. Then is the sciatic nerve, which originates from L4 to S3. The two branches of it are common peroneal and tibial nerve. So common peroneal nerve, it gives sensory supply to lateral calf and dorsum of the foot, and tibial nerve particularly supply toes and the plantar surface of the foot. So common peroneal nerve, it is responsible for dorsiflexion or eversion of the foot. If that is not happening, that is there is no dorsiflexion, the foot will be plantar flexed, and this condition is known as foot drop. So this is a commonly asked question, that which nerve causes foot drop. Then it is common peroneal nerve. Then tibial nerve, it is responsible for the opposite function, plantar flexion and inversion of the foot. It causes cavus deformity of the foot. Then the other five nerves, iliohypogastric, ilioinguinal, pudendal, lateral cutaneous nerve of thigh, and genitofemoral, these are primarily sensory nerves and they do not cause any motor abnormality. So basic problem which these nerves cause is they cause sharp burning pain radiating at the site where they supply. So like iliohypogastric, it supplies the mons, lateral labia, upper inner thigh. So there will be sharp pain at this site. Ilioinguinal nerve injury will cause sharp burning pain in the region of the groin or symphysis. Pudendal nerve will cause pain in the perineum. Lateral cutaneous nerve of thigh will cause pain paresthesia in the anterior or posterolateral aspect of the thigh, and the condition is known as meralgia paresthetica. Genitofemoral nerve injury will cause, it supplies the femoral triangle, and it will cause pain paresthesia in the region of labia or the femoral triangle. So that was all for today. Thank you so much.